Happy Valentine's Day, everyone, and thank you for joining us today for No More Heartbreaks, Why Dental No-Shows Happen and How to Stop Them. So this presentation is for dental professionals. So if you're an office administrator, front desk staff, dentist, or any other dental professional that really wants to learn more about how to stop no-shows from happening at your practice. So to kind of introduce ourselves, I am Jennifer Zapp. I'm the Senior Director of Marketing at Intiveo, and I'll be your moderator for today. And we have our amazing speaker, Nathan DeVries, who's our Chief Customer Officer of Intiveo, here with me as well. So as our Chief Customer Officer, Nate's mission is to put our customers at the center of everything we do. He's very committed to learning our customers, understanding their needs, and then using that knowledge to drive innovation across the entire company and industry. So he has over 15 years of experience in the dental industry specifically, and has a deep understanding of the challenges that practices face when it comes to patient communication, which is why he and his brother Josh founded Intiveo back in 2010. And since then, Nate has been dedicated to developing software solutions that help practices improve the overall patient experience. So he's definitely an expert in this topic, and very looking forward to the presentation that he has for you today. So before we get into it, I just want to briefly outline the agenda. We're going to be talking about 3 key topics. The first of which is the impact of no-shows on your practice. So we have some really great stats that show the actual tangible impact of this, as well as why they happen, and then tips on how to reduce no-shows. And then at the end, we have some time carved out for question and answer period. So if you have any questions that come to mind during the course of the presentation, please pop them into the Q&A box at the bottom of your screen, and we will get to those at the end and answer those questions for you. So without further ado, I will pass it on to Nate. Nate, take us away.
Awesome. Thank you, Jen, for the kind intro. I'm Nathan DeVries. I'm the Chief Customer Officer here at Intiveo. I'm here to talk to you about no-shows today. The presentation is called Dental Practice Management Presents Many Challenges, but no-shows do not have to be one of them. Like Jen said, I've been in dentistry for around 15 years. And this is one of those things that just irks me because for me personally, no-shows feel like the most unnecessary part of your day. And I go a little further when I define no-shows to include short notice cancellations and unprepared patients, which lead to like appointment failure. All of those kind of fall into the same wheelhouse. Even though today's presentation's focus is really on just pure no-shows of not coming to your appointment, I'll throw out little tips about how to deal with those other 2 issues as well. So let's just jump right into it. No-shows occur in all business places, but rarely do they have the all-encompassing effect that they do in the dental office. They disrupt the workflows of both the front and back office. In the end, no one is happy, the front office team or the patient. So just to read a little quote, it works good on Valentine's Day. The no-show is the equivalent of getting stood up, except with higher consequences. If a date stands you up, it results in hurt pride and a wasted outfit. No-shows in your dental practice cost you money and hurt your practice. So there are a few time-proven strategies that office administrators already use to reduce no-shows. I think we all can kind of think of them and list them out. Handing out an appointment card after their last hygiene appointment, sending out mail outs. Both of those actually have quite high costs these days, both in printing and postage. And then there's obviously picking up the phone and just rolling for dials. And so manually calling the patient a week to confirm their appointment or reminding them the day before. The problem with that is that you're calling during work hours. And so most people are not picking up their phones anymore. It's going straight to voicemail. And then you're playing that unenviable game of phone tag. And I have also seen some offices even like email manually, or they have an office cell phone to text. You can do all those sort of things, but they do result in minimal improvement. And so just another quote for you. Manual processes are very time consuming. And with each year that passes, these inefficiencies will cost your dental practice more and more. So let's just really break down the impact of the no-show on your practice. Like I mentioned earlier, I think no-shows are the worst. They disrupt the workflows of both the front and back office, like I'd mentioned earlier. They cause disruption to the continuity of care for patients through delayed treatments. In the end, like we said, the provider, the front office team, and the patient all can be quite upset. So let's go ahead and do a few quotes, a few stats here, sorry. There was a dental economics survey that reported up to 10% of appointments are canceled, adding up to a significant cost. Depending on your market, we've seen this skyrocket after COVID. So don't feel bad if you're finding this a little higher as patients become a little less likely to show up to their appointment and don't tell you about it. But in terms of financial cost, if a practice loses one appointment each day of the year, the lost production for a large practice could be over $70,000, depending on the treatments you offer. No-shows cost the dental industry a whopping $150 billion on an annual basis. $200 per appointment is the average, although we can all think of a big case that kind of goes sideways when a patient came ill-prepared or just no-showed. So most of the revenue that's lost comes in the form of decreased productivity, and that's empty chairs in the office, but also the inefficiency caused to the schedule. Often we're actually able to fill that appointment with a last minute or an ASAP appointment, but then we're often replacing a lower value appointment with a high value appointment, which also is a reduced productivity. And then for a lot of people here, this next one is going to be the bigger one, which is staffing imbalances. A missed appointment isn't just about losing money or scheduling inefficiencies. I talk to administrators pretty regularly, and they often tell me that as the workload in the back slows down, the workload in the front actually increases. No-shows mean lost time in the front office, who now have to take time away from their other duties so they can attempt to reschedule that patient and call them back with new appointment times. But that's usually only after you're done trying to get a patient from the wait list to make up for that no-show. So this leads to more stress for both your team members as well as your patients. So they end up having to wait longer than anticipated. So reduce patient satisfaction. I think a lesser known thing, or maybe lesser actualized thing, is that when a patient no-shows, they're actually not pumped. Patients who miss appointments may not receive the care they need, which could be harmful to their oral health. But more commonly, patients may express frustration with the lack of communication from your practice if this is simply due to them forgetting their appointment. In my experience, many negative dental reviews come from patients who no-show their appointment and think it's the office's fault. Rescheduling an upset patient can be difficult for your team and cause stress. So I guess all three of these things kind of show why the doctor would be upset, why your front staff teams might be stressed or increase their stress, and then also why the patient's upset. So let's just kind of figure out why no-shows happened now that we understand the impact. After speaking with hundreds of customers over the year, I understood there's two main factors that create no-shows. The first is scheduling miscommunications. This can occur for many reasons, lots of which may not be your fault. Patients may not understand what's expected of them when it comes to canceling an appointment. They may be confused about how far or early in advance they need to cancel their appointment. Especially because we book appointments often quite far in advance. They may have gotten the wrong date or information, or they may have unintended scheduling conflicts with other commitments. And a lot of these things can come up last minute, like a sick kid or a spouse who isn't able to help out anymore. So 32% of surveyed patients have reported no-showing for their appointments due to scheduling miscommunication. The other big reason is simple as forgetting. And I think that it's we need to, as dental care practitioners, we need to lead with compassion because life happens. Double bookings occur, sick kids, transportation. It's not your patients that don't want to come. It's that they simply don't remember when their appointment is. And it could be due to a lack of appointment reminders. 36% of surveyed patients have reported forgetting about their scheduled appointments for no good reason. Just they didn't write it down, or they got busy and they just forgot. But that doesn't actually help your practice. So how do I reduce or stop no-shows from happening in the first place? Well, lucky for you, we've got a lot of experience in this, and I can share some of the things that we like to talk about. So we can quickly recap the traditional methods that I talked earlier, which would be handing out appointment cards, manually calling patients a week before to confirm their appointments, or the day before to remind them of their appointments. You're dealing with the phone tag and the sent to voicemail then. And I also mentioned some offices have a cell phone or email their patients. But this all sounds like a lot of work. So you're focusing on reaching to patients to book appointments or to remind them instead of caring for the patients that are in your practice. And I think we can do better than that. What if we could automate all of this? What if we automated your workflows? We communicate the way the patients want to be communicated with. What if we could deliver timely details to your patients to make sure the information the patient needs for a successful treatment outcome is delivered? What if we could make rescheduling convenient? Rescheduling patients well in advance of their appointment so you're able to properly fill the chair with a high value appointment. Let's go ahead and look at some sequences that I think you could do either with an automated system or with a lot of work, a manual system. And maybe we could start with something a little more complex, like an implant, where the stakes are high for the office. Implants are a high value treatment with multiple appointments and lots of documentation. Implant cases usually involve a consulting appointment and may even require more documentation the patient has filled out in the past. These are very easy ones to have a patient come ill prepared or to show up late or cause a bit of a trouble for your office schedule. So let's just kind of go through the ideal automation sequence for the consult to start with. Often we have to fill out diagnostic or medical history forms and HIPAA consents for new patients and even some existing patients. And we like to send that out a week beforehand with another reminder 48 hours before. Appointment confirmation sent 3 days before the appointment. The important thing about giving patients 3 days to confirm their appointment is that they have the opportunity to cancel before it becomes a short notice cancellation. And then also 24 hours before the appointment, you might send a wellness screening if you're still doing COVID forms, as well as an appointment reminder to make sure the patient isn't going to have an unintended experience that's going to make them not be able to show up to their appointment. After their consult, they're going to have their actual treatment. And this could be anywhere from 5 days to 3 days after your consult. Sometimes it's 2 weeks, depending on your schedule. So bear in mind that this can get longer period or a shorter period of time. So for the actual implant surgery, there are many moving parts that all need to be communicated at the appropriate time. So you have your pre-appointment instructions and procedure consent. This is generally sent 5 days before the appointment with another reminder once again at 48 hours. The confirmation for the appointment sent 48 hours. We generally have some form of reschedule option, at least in the pre-appointment instruction email we send, if not at the confirmation 48 hours beforehand. A wellness screening and fasting instructions, if relevant, 24 hours beforehand. We all know the last thing we want to see is when a patient needs to be fasted, them eating that Starbucks sandwich and drinking a coffee as they come into the office. So a 24-hour notice usually is pretty good to remind them about. After their appointment, we actually can send some other things like post-appointment instructions after surgery or any appointment, even especially with little children. Often parents or people who had the surgery are in such a rush to leave the appointment, they actually forget what they do with all their post-appointment instructions. And so it's nice to be able to send those afterwards for follow-up. And then a satisfaction survey. It's nice to know how your office did. So at the conclusion of the patient journey, it's nice to make sure that your office hit all the marks and then ask them to leave you a Google review to boost your reputation of your practice. So personally, with Intiveo automation, it's easy to send the right message to your patient at the right time. You can catch a patient at the right time when the instructions will be the most impactful. 12 or 24 hours before their appointment, like I had mentioned, or emailing or texting for follow-up care. So just some time-saving tips here. We discussed how this can support your patient, but what does this mean for your practice? We've been able to see firsthand some improvements that come when your practice starts using online forms. Some of these are going to be dependent on the demographics of your practice and the type of forms you choose. How integrated your forms are into your patient practice software. Sorry about that. Gains. Nonetheless, this is what we want to see from our patients. When you're able to marry your appointment automation with your forms, you really get something great. The right message to the right patient at the right time, which leads to the right outcome. A prepared patient. What is a prepared patient? One that confirms their appointment, comes at the correct time, and has fulfilled the requirements of their appointment, whether it's filled forms, taken the pre-meds, or fasted. So some changes you can expect to see when you automate a lot of these processes is 70% confirmation of your forms, up to 80% decrease in no-shows, as well as 1 to 2 hours saved per front staff member each day. This really reduces manual tasks, maximizes your staff work time, and improves accuracy. What I really like about doing a lot of this stuff is allows you to focus your time on the patients who actually come into your practice and boost the morale of your teams. Yeah. So just to quickly recap what we've seen so far is no-shows can result in lost revenue, staffing imbalances, and reduced patient satisfaction. The most common reasons for no-shows include scheduling miscommunications and patients forgetting about their scheduled appointments. With strategies like automating workflows, sending timely reminders, and making scheduling easier for patients, you can see a reduction in no-show rates at no time. As a way to say thank you, we've actually created a little bit of a strategy book for highly effective strategies to reduce no-shows. I will follow this up with an email, but feel free to grab your phone and use the QR code if you have that to snap that and download that. This is a really helpful guide that we've created. Otherwise, you can always reach out to us and we can give you a run through of how we actually implement this with our software. Awesome. Thank you.
Great. Thank you, Nate. We do have some great questions in here, so we'll go through those, but also just a reminder, if anyone has any more, please pop them in the Q&A box and we'll get to those. So firstly, this is a good one around metrics. So what metrics should practices track to measure their success in reducing those patient no-shows?
Yeah, I think the most important thing that you need to track is obviously the no-show rate itself, and also the patients that you're seeing the most amount of no-shows. But I think also you need to go ahead and do a bit of a customer journey for your practice. You need to find out when you're sending messages and what your response rate is from patients. And so tracking your response rate from patients will really let you know whether or not the right message is going to your patient at the right time. And so no-shows aren't as much of an issue. Often practices send messages at the incorrect time, which means you get really low engagement with your patient and they just don't show up.
Okay. And then, for if patients or if practices notice that there's specific patients that have really high no-show rates, do you have any tips for how to approach that situation?
Yeah, like I said, I think that you have to take a look at who is actually no-showing. So if it's at the end of the month and you're looking at it and you're seeing your no-show rate increase over 10%, really, anything over 5% is probably a little bit high. Is getting high. I think you probably want it in the 3%. You want to look at who those patients are and then tailor your messaging for them. And so I always, when we do implementations, we often ask who is the demographic of your patients. The biggest reason we actually see, to be honest, is that you're relying on voice or email. A majority of people want to confirm and be reminded via text message, regardless of their age. And so that's usually what it is. Usually you set your reminders up for older demographic who you don't think will be as engaged via their cell phones, and they definitely will be based on their experience.
Great. A couple more here. So yeah, what is the best time to send the automated appointment confirmations, like over text or email? Do you have any tips for that?
Yeah, I think kind of maybe it's more common sense for myself, but I think that when we see emails or text messages, the best time is around lunchtime. A lot of working professionals can have access to their cell phones during the workday. And so at lunchtime is a natural time for them to be able to check up on their messages and naturally confirm. So making sure you send it just before lunchtime so they're able to. Also being available, your staff at around lunchtime to take in phone calls, knowing that's probably the only time that your patient's going to be able to call in and reschedule or rebook. And then for phone calls, it's always around dinner time, unfortunately. We track those metrics pretty heavily, and it's 6 o'clock is the most likely to get a phone call answered and confirmed. So ironically, generally not when the office is open. So using an automated system for those patients that still want to be phone called is a lot better because it can call when your office is closed.
Okay, great. And related to that a bit here, there's a question on, is there a way to have reminder messages go out on Sundays for Monday appointments, like the day before, or is there a way to schedule that? Because, they seem to have, the issue with forgetfulness that you mentioned on Mondays in particularly, which is interesting.
Yeah, so I have seen some. If you're going to do it manually, I like to not just make it all about ourselves. But if you do it manually, we often see office managers take home a list of patients they need to call from their home on Sunday afternoon or night. Um, but obviously, if you automate the system, you can just set it to go on the weekend when you're not there. I think that we often see a lot of rescheduling that occurs, and that can kind of be an issue for patients. And so when you have an automated system with a web-based portal where maybe your office manager or a front staff or whoever on your team would be responsible for that could just log in on Saturday or Sunday, they could very quickly see who said they're not going to come for Monday. And so there's not that whole misstep between who you think is going to be there on Monday and who actually is going to be there Monday.
Right. And then, so when you do have, no-shows, like, do you have any tips for how to recoup that lost revenue that happens?
Yeah, so most offices are marking an appointment. If a patient has like clearly said that they want to come in early, then they mark in their PMS that it's like Dentrix, in case you're not familiar with the term. It's whatever patient management system you have. They're going to mark that patient is like a short notice patient or an ASAP patient. And then you can either print that list out and actually call those people when you have a no-show, or you could use an automated system to just blast them out and get feedback right away at who can come to that appointment.
Okay, great. And then how do you make rescheduling easy for patients?
Yeah, I think that appointment cancellation is kind of like a bad word in dentistry. And so we always want to encourage a reschedule. And the trick to doing that is actually making sure you're sending out a reminder early enough that you could actually ask them if they want to reschedule. And so we often will send out one 5 or 6 days beforehand. And it might just be a reminder with an option to reschedule. And then if you send one close to the appointment, like 24 hours or 48 hours, you might not have that cancellation or reschedule option. I prefer to give patients the option to reschedule in everything up to 24 hours beforehand, because at least then the biggest negative, especially people who suffer with no-shows, is they don't want patients to reschedule, but rescheduling is better than a no-show. And we know the frustration with that. So if you are suffering from it, give your patients more opportunities to actually reschedule their appointment, because it gives you more opportunities to fill that appointment.
Okay, and related, this is a pretty specific one, so this is interesting, but someone asked, we ask our patients to give us 2 days notice, and if not, we charge $75. Do you think that's too aggressive? Or do you know of kind of like the common rates?
I don't actually remember the common rate, but charging a no-show fee is actually quite common. I don't know many offices that actually charge the fee. It's more usually just the stick that you have that you say there will be a $75 fee to drive the behavior you want. I think that if you charge people all the time, you might lose patience over that. And I think that's what people's fear is. I don't think it's bad to have the policy. I just think that having the policy and not having an easy way for the patient to reschedule is kind of conflicting. You want happy patients and you want patients to show up to their appointment. And I think that's totally possible. So for that specific thing, yeah, I think cancellation policy to let a patient know that your time is valuable makes sense.
Yeah, for sure. So also, like you mentioned earlier around trends that you may have seen recently, do you see can you expand on that a little more? Like, have you seen any trends on no-show rates over the past few years? And what do you think about, looking forward? Do you have any predictions for that?
Yeah, I think we're still in that, there's definitely been a trend. No-shows are skyrocketing right now. So the larger your practice and the less, I guess, personal it feels. No practice feels unpersonal, I know that. But sometimes when we look at some of the DSOs, or we look at a university, or maybe a practice that has 6 locations and everyone kind of knows they're on every corner, those practices generally have a higher no-show rate than the smaller practice. But for everybody, definitely it's increased since COVID. And I don't quite know the psychological reason why it's increased, but people don't feel as much need to give a warning about it. And so, yeah, it's definitely been on the rise. And so that's really where my focus with how we resolve this is to give patients the opportunity to reschedule their appointment and letting them know that if you can't make it, that's okay. You just need to let me know an appropriate amount of time beforehand. Because rarely is it just a last minute thing. It's usually they've forgotten or they know and they just aren't able to get hold of your office through voicemail. And so I guess on that point, having an ability for the patient to text your office and you can text them back with a two-way chat type system also should help.
Yeah, that's great. Thank you. So we have one last one here, and it's you know, I think like the automation that you showed is great, and like some people do have a program implemented, but may still get no shows. You know, so because of patients forgetting, and then they have to, you know, also call or text. Do you have any tips for kind of tweaking your program and improving your automation so that, you know, you may get better rates?
Yeah, I think configurability is key. I can't speak to the system you use, but I know one of the things that we do if patients can't confirm is just have an automated ability to resend a message a little closer to the appointment. Um, Also, depending on the appointment, sending a custom sequence for the appointment they're seeing makes you gives you the ability to word your messaging different and kind of raise the stakes for higher value appointments. And I know probably a good percentage of your no-shows are going to be lower value appointments, like maybe a hygiene appointment, which is more regular occurrence. But being able to send a targeted message just to hygiene appointments and then send a different message sequence to like a surgery or crown and bridge, whatever, like I think that really makes a big difference in terms of having people engage with the treatment they're coming for, rather than just receiving the same generic message they might get from a restaurant or their hairdresser. Making sure that message is tailored for that patient and their appointment makes them feel more engaged and bought into the reason why they're coming to the practice.
Great, thank you for that. That concludes the questions that we had, unless anyone, you know, still had anything that you wanted to pop in there. We do have a couple minutes we can answer any additional, but yeah, so I'll just give it one quick sec here. But looks like nothing's coming in. So that wraps it up. Thank you very much, Nate, for all of that. And thank you all for joining. Yes, we'll be sending up a follow-up with that guide in case you're interested in that. But yeah, have a great Valentine's Day, and I hope you experience no heartbreaks today and that you experience all of the love. So yeah, thank you for joining us. And
Thank you, everybody.